Welcome back, everyone, to part 2 of our 15-part Interventional Radiology Coding series. If you are here for part 1, you know we've already started unpacking this incredibly fascinating, though sometimes kind of complex, world of IR. Well, today we're focusing our lens on an absolute cornerstone of medical coding in this space. We are talking about the fundamental split between vascular and non-vascular procedures. Honestly, as an educator, I can promise you that mastering this one distinction, it's a total game changer. It is going to make your daily coding practice so much clearer. So, get your notes ready, and let's dive right into today's explainer.
All right, here's a quick roadmap for today. We'll kick things off with our welcome to part 2, then move into defining vascular IR, followed by defining non-vascular IR. After that, we've got a quick interactive knowledge check, and we'll wrap up with a summary and our next steps.
So, let's get right into it. Welcome to part 2 and the fundamental dichotomy of interventional radiology. To accurately code in IR, you really have to understand that this massive specialty is essentially split down the middle into two major anatomical branches, and the critical difference between them lies in one very specific boundary, the bloodstream. It's like a literal border wall in coding. On one side, we have vascular IR, which focuses entirely on the blood vessel lumen, meaning the inside of the vessel itself. On the other side, we have non-vascular IR, which focuses on solid organs, tissues, and internal cavities. The dividing line is simple, but it is absolute. You just have to ask yourself, is the physician working inside the bloodstream or outside of it? Keep that rule front and center, because it's going to be your guiding light for CPT coding.
Okay, defining vascular IR, inside the bloodstream.
Let's look at the formal definition. Vascular interventional radiology covers procedures dealing directly with the blood vessel lumen, so your arteries and your veins. The primary goals here are to restore, modify, or evaluate circulation. We're talking about those image-guided, minimally invasive procedures where the catheter is navigating the literal highways of the human body. The absolute key words I want you to mentally highlight here are blood vessel lumen and circulation.
Just take a second to look at these glowing arterial and venous pathways. They perfectly represent the intricate, closed-loop vascular network that physicians are navigating during these specific procedures. When a physician is working in here, they are completely inside a continuous closed system. They might be injecting contrast dye to pinpoint a blockage, or maybe planning a cardiovascular intervention. But understanding this specific closed-loop anatomy is the secret to getting vascular coding right.
To make this super concrete, let's just walk through a few common clinical examples directly from our source material. We've got angiograms, which are your diagnostic procedures to visualize the blood vessels. Then we move into therapeutic procedures, like angioplasty, to physically restore circulation. Stent placements to keep those vessels propped open. Thrombolysis to break up stubborn clots, and embolization to purposefully block abnormal blood flow. Are you noticing the pattern here? Every single one of these involves treating a condition or a blockage directly within the blood vessels themselves. The whole procedure relies on accessing that arterial or venous family.
All right, flipping the script. Defining non-vascular IR, outside the bloodstream.
Now, not all IR procedures happen in the vessels, right? Non-vascular IR focuses on image-guided procedures targeting organs, solid tissue, and non-vascular body cavities that are entirely outside the bloodstream. Now, the physician is still using real-time imaging like X-ray fluoroscopy, ultrasound, or CT to do minimally invasive work, but the final destination has absolutely nothing to do with circulation. Instead of a vein or an artery, the target might be the liver, maybe a fluid-filled abscess, or even a tumor in the lung.
And because the target is different, the approach is different. You'll often see specialized tools used here, like catheter drainage tubes paired with real-time ultrasound imaging. In non-vascular IR, physicians rely heavily on this image guidance to safely maneuver needles or tubes directly through the skin and into those specific organs or abscesses. They aren't traveling down a vascular highway to get there. Instead, they're taking a direct, percutaneous approach to reach the specific solid tissue or cavity.
So what does this look like in your coding queue? Let's check out some key clinical examples for non-vascular IR. We have fine needle aspirations, or FNAs, and needle biopsies, both used for extracting tissue samples for diagnosis. We've got drainage tube placements, which are super common for clearing out an abscess or unwanted fluid from a body cavity. And of course, tumor ablations, which use energy to destroy tumors sitting right there in solid organs. Again, the defining characteristic here is what we are not doing. We are extracting tissue, draining fluid, or destroying masses in non-vascular spaces. No arteries or veins are the primary target here.
Okay, interactive knowledge check time. Let's apply your coding intuition.
All right, everyone, it's time to actually put this theory into practice. Take a quick moment, get ready to engage with the material. I want you to think critically about what is being accessed anatomically as I read this next scenario. It's pulled straight from our source documents. Let's see if you can classify it correctly before we reveal the answer. Ready?
Here's the scenario. A physician performs a catheterization injection procedure for an antegrade nephrostogram and/or ureterogram. Complete diagnostic procedure, including imaging guidance and all associated radiological S&I. Okay, based on what we've just covered, how would you classify this? Is it a vascular IR procedure? A non-vascular IR procedure? Both? Neither? Think about the anatomy for a second. Where exactly is the physician working?
All right, let's break down the logic step by step together. Step 1, we have to identify the target. A nephrostogram and ureterogram involve the kidneys and the ureters, right? That is the urinary collecting system. Step 2, determine the location relative to the bloodstream. Well, the urinary tract is a distinct system completely outside the blood vessel lumen. So, step 3, our conclusion. Because the physician is working entirely inside the urinary tract and not the bloodstream, this firmly belongs in the non-vascular category. If you guessed non-vascular IR, fantastic job. You are totally grasping the core anatomical logic you need for accurate coding here.
Moving on to our summary and next steps as we wrap up Part 2. Let's just reiterate this primary dichotomy one last time, because honestly, mastering this split is absolutely critical for your accuracy. Remember, vascular IR means the work is happening inside the lumen of the arteries or veins to manage circulation. Non-vascular IR means the work is happening outside the lumen, targeting solid organs, tissues, or cavities. If you can just remember this simple inside versus outside rule, it's going to serve as the bedrock for everything else we build upon in this series. And speaking of building upon this foundation, in our next explainer, Part 3, we are going to dive much deeper into the vascular side of things. We'll be learning the crucial differences between diagnosing a vascular condition, like with an angiogram, versus actively treating it, like with an angioplasty or a stent placement. It is a vital distinction that dictates entirely different code sets, so you definitely won't want to miss that one. Before we sign off today, think about the last really confusing operative report you stared at. If you had just applied this simple inside versus outside rule right off the bat, would it have changed your coding path? How much time would that have saved you? Keep that in your back pocket for your next shift. Thank you for watching, and keep learning with Decode Healthcare with Harshal.